Hello, this is Dr. Stanley Lang, and welcome to this presentation. This is a continuation in a series on whole person health strategies for wellness, today focusing on physical health issues, particularly the problem of low HDL. So HDL stands for high density lipoprotein. So HDL is considered the so-called good cholesterol. There are some subtypes of HDL which are better than others, but basically most of the time, the higher the HDL, the better. On the other hand, if you have an HDL deficiency, that's considered a significant risk factor. Some doctors think it's a lot more important than paying attention to HDL than to the so-called bad cholesterol, the LDL. And I'm one of those physicians. And today I saw a patient that had a heart attack about a year and a half ago. He had couple major things wrong with his chemistry at that time. Number one, his HDL level was in the basement. It was just slightly over 20, which is really, really low. And the second thing was that he had a very high homocysteine level. His so-called bad cholesterol level really wasn't very bad, but true to form, the usual strategy was to put him on a statin drug, which didn't address these other two major risk factors, which is his HDL was still astoundingly low, and his homocysteine level was still dramatically high when I first started to see him. And so he, after hearing different aspects of the things that these two things I just told you about, high homocysteine, low HDL, how they might contribute to coronary disease, he was very interested in some of these non-traditional medical strategies to try to rectify these. And today I'm going to focus on the HDL issue. So most of the time, doctors don't have a lot of hope of raising the HDL a lot. But what I discovered a few years ago was that there was a sort of a two-step sequence that you could go through that would help to raise your HDL. The first step is to eat in a very low glycemic way. That means to eat foods that don't raise the blood sugar quickly. Now, in other videos, I've gone into a lot of detail of what that means in practice, but the point is, step number one, you have to eat very low glycemic. Now, if you eat very low glycemic, then if you add in a lot of omega-3 oils in the form of the right type of fish oil, then that second signal will start to raise the HDL after about 6 to 9 months. So the key is understanding how long it takes for the liver to turn things around in terms of making the right amount of the right kind of cholesterol particles. But the first step is that you got to eat low glycemic. You can pour all the fish oil you want to into the system, and it will not significantly raise the HDL levels if you're still eating a lot of high glycemic foods. So how many high glycemic foods can you eat and still get away with it and still get your HDL to rise? Well, only God knows the answer to that. So usually what I tell people is don't eat any of them, at least for 9 months, if you're serious about wanting to raise your HDL levels. And most of the time I see people raise the level significantly. Now, a year later, this patient's HDL level is almost twice what it was when I first saw him. That is a dramatic increase, way beyond what I was taught in medical school or residency as possible, or in any of the traditional medical education that I've had since then. So if your HDL is low as a risk factor, or it's just barely normal and you'd like to have a lot higher range, those are the two things that you can do. And there are others, but those are two easy things that you can do that will raise that HDL level. Number one, cut out the high glycemic foods. Number two, eat the right amount of extra fish oil to stimulate the liver to make more HDL. So this is the cornerstone, I think, of addressing cholesterol disturbances. And so I encourage you to pay attention to that if that's an issue for you. I wish you well, God bless, and have a great day.